need to get the out of here.
You can run.
I was on top of a tank and the blast was ahead of me and it blew me off the tank. And
You can hide.
My truck was hit and my head was thrown back into the turret.
You can pretend that it's rain on your face, not the tears you cry.
the nightmares and memory loss and family trouble.
But you know what people say, and every minute, every hour you'll be wishing it was just a day.
I was sleeping 14 hours a day just to avoid being alive and handling the pain. All I wanted to do was sleep and then watch TV and not talk to anybody. I didn't want to live.
And that's the price.
Kind of getting weak. We got an IV on him.
Kind of show of hands, how many guys have been hit by an IED?
All of us.
See, you've all experienced an IED.
Yeah.
Traumatic brain injuries, or TBI as they call it, have become the signature wound of the wars in Iraq and Afghanistan. Nearly 10% of those who served there are believed to be suffering from some forms of TBI.
There's something wrong with their face. We're going to figure it out here right now.
My face developed Bell's palsy. I had surgery to cut out the occipital nerve. They gave me morphine pills and morphine patches, Percocet, Vicodin, anything to just numb the pain.
Frustrated by her debilitating pain and lack of progress, Margot and other vets are turning to hyperbaric oxygen therapy to help turn their lives around.
I feel lightheaded a little bit. I just feel real relaxed, honestly.
Margot and Shane say they could feel the difference after the first of their 40-hour-and-a-half sessions in these pressure chambers, which can put 10 times the normal amount of pure oxygen into their systems.
Okay, Margot, how you feeling?
Good.
Okay, you're about halfway done with your treatment.
It's been proven safe and effective by the FDA for treating everything from decompression illness to healing wounds, but has yet to be approved for treating traumatic brain injuries.
And we're bringing increased blood flow, increased oxygen, and allowing new blood flow, new blood vessels to grow into the damaged area. It brings the injured cells back online and helps them be more functional than they had been prior to the treatment.
Dr. Julie Stapleton, the medical director for rehabilitation services at Boulder Community Hospital, volunteers as the medical director for the Rocky Mountain Hyperbaric Association, a 501c nonprofit treating vets suffering from TBI and the related PTSD symptoms.
I've been treating traumatic brain injury and other neurologic disorders for 25 years. I've seen a lot of treatments come and go, and I think overall this is the one treatment that I've seen that actually is therapeutic. It actually treats the symptoms. Medications manage the symptoms, they do not cure.
Because it is yet to be approved by the VA or the FDA, vets who want the treatment have to pay for it out of pocket, as much as $4,000 to $10,000, depending on the clinic, and pro bono programs, like the one the Rocky Mountain Hyperbaric Association has created through donations and the help of local veterans groups.
We are supporting this, trying to bring awareness, trying to earn money to where we can support and give treatment to our troops.
It's the only thing that I've been able to do since I've had these injuries that has got me to get myself off of these medications, that's got my headaches to start going away. To be able to think correctly for myself and to be my own self. And it's oxygen. It's not putting something into my body that is harmful.
I would say that hyperbaric therapy in and of itself is probably a better investment and cheaper in the long run compared to using medications long term.
The association has a guest house near the clinic for out-of-town vets coming here to the Boulder area for the hyperbaric oxygen therapy.
You're about halfway through your treatment. If you start remembering stuff, nightmares, you start remembering more stuff, a lot more vivid, we need to talk about it. Okay.
The clinic also works with therapists like Pepe Ramirez, a former Marine Sergeant Major who earned his master's degree in social work after 3 tours of duty in Iraq.
He talks me through the situation because he knows the situation. He understands what's going on. So he can talk you through it and help you from being so scared about things that have happened to you before coming back to you again.
Don't waste your thoughts upon the past. 'cause there's a future out there, and it's yours if you dare.
I know it's worked for me because I was on the couch when I started, and now I'm climbing 19,000-foot mountains and riding my bike over 2,000 miles across the United States, and I'm about to accomplish walking to the South Pole. I have medical documentation. I have a SPECT scan that says here was my brain there, and now my brain is better.
I'm not wanting to have the past relived in the future, that's for sure. I'm wanting to move on and live my life as Shane Amos, not Sergeant Amos anymore.
We don't leave anyone in the battlefield. These men and women, we're in a totally different kind of war now. Every day is a battle. Waking up every day and just trying to cope with our family issues. It's a whole new battle.
Every minute, every hour, you were wishing it was yesterday. Oh, and that's the price you pay.